Intense headaches triggered by sex are a real thing and can be dangerous. By Colin Davidson from The Conversation. The last thing anyone wants is for sex to be a headache. For some people, though, an increase in sexual excitement can be a real pain in the neck. Primary headache associated with sexual activity, PHASA, describes at least 2 bouts of pain in the head or neck brought on by this type of activity. The headache can escalate gradually during activity, or it can be an intense headache just before or during. Phasa can be intense for between a minute to 24 hours, or mild for up to 3 days. The most common type is a rapid, intense headache at or around orgasm. These headaches are 2 to 4 minutes, 4 times more common in men than in women. It's estimated that the condition, also known as sex headache or coital headache, orgasmic headache, and coital cephalalgia, occurs in 1 to 1.6% of the population at some time in their life. However, the real figures could be higher. Phasa often goes unreported, most likely due to stigma around the discussion of this. The reasons why these types of headaches happen are not fully understood, but since people with hypertension are more likely to get Phasa, they are likely associated with high blood pressure. Phasa is also commonly found in people who normally suffer from headaches or migraines. Sex headaches could also be caused by abnormalities of the veins around the head and neck. Studies found that venous stenosis, a narrowing of the veins, and headaches triggered by coughs or exertion are associated with Phasa. In April 2024, it was reported that a 61-year-old woman in the US suffered a brain bleed after having sex. The woman, not realizing it was bleed, took an aspirin for the headache. Aspirin is a blood thinner, and while useful for people who might be at risk of ischemic stroke, a blocked blood vessel, it could be disastrous for someone with a bleed. This woman took 3 aspirins, which may have contributed to her bleed, but thankfully, according to reports, she has now made a full recovery. Brain bleeds while having sex are more common than you might think. Other forms of physical exertion can also bring on a stroke, including running, lifting heavy weights, even sneezing, straining on the toilet, playing the trumpet, and bouts of laughter. In the US, up to 1 in 12 patients going to the emergency room because of a brain bleed were having sex at the time of the pain started. The hole in the heart could be a risk factor for stroke during sex. A hole in the heart, or patent foramen oval, PFO, is a small flap-like hole between the top 2 compartments of the heart, and this hole is seen in everyone prior to birth and typically closes just before birth. In a case report of 3 unusual triggers for stroke, 2 of the 3 patients had PFO. 1 stroke was brought on by sex, while the other from a bout of laughter. Another study has found PFO to be common in people who have a stroke during sex. A more recent U.S. study trawled medical records for patients who had had an intracranial hemorrhage brain bleed during sex. They found 16 recent cases. The average age of these patients was 50, and 13 of the 16 patients were male. 31% had hypertension. Half of the patients had an aneurysmal subarachnoid hemorrhage, a burst blood vessel that is in the brain, or ruptured brain aneurysm. 2 of the 16 had an arteriovenous malformation, a tangle of blood vessels, and 2 had a deep brain hemorrhage. If you have had a headache during sex, then you should certainly see your doctor, who can treat you with drugs typically used for hypertension, including beta blockers and calcium channel antagonists. The doctor might also suggest a more passive role during sex or even abstinence while further tests are done to rule out more worrying explanations. Much is still unknown about who is at risk of stroke during sex. However, if you are a male of around 50 years of age who has experienced a headache during sex, you might want to get yourself checked out for any aneurysm or hole in the heart. It's likely that your headache can be treated quite easily, but there will be some people with unknown and potentially serious underlying health conditions. And this is from the conversation here under Creative Comments by Colin Davidson, Professor of Neuropharmacology, University of Central Lancashire of the UK, and it's on Science Alert. Please leave your comments and thank you for your support. Finally, support my Patreon account. The daily posts are 5 videos daily, and they are totally different from what I have on my YouTube channel. Thank you so much for your support and that you find all my content so interesting. You'll find the Patreon account details in the description box below.